Dr Flavia Senkubuge, the WCTOH 2018 president, joins us in studio for a chat focusing on public health. Flavia, thank you very much for joining us. It's a pleasure to have you here. Well, how do you feel about this tobacco conference finally coming to South Africa?
Totally excited. I think this is the best thing that has happened for the Africa region, and particularly if you look at the context and the time of when it's happening, because right now we are faced with a number of issues. In some African countries we have a quadruple burden of disease, and in some a triple burden of disease. But a lot of the risk factors of our diseases, one of the ones which are preventable is actually tobacco. And so we do know that right now we are front and center in terms of the interest of the tobacco industry, because the African population has got the youngest population, and that is their target market.
So what's the run-up to the conference been like, the build-up? I mean, what have you been involved in?
Quite a number of things. I think one of the things which has been so exciting for me is to have a team from Singapore who have actually trained our community health workers and our young people on the tobacco-free generation concept, and capacitating them to actually be champions for a tobacco-free generation. So we have gone to our communities in the Western Cape. We were in Guguletu, we were in Philippi, and so in the run-up to the conference we've actually concentrated on the tagline, leaving a legacy for Africa. The lead-up has been quite busy, but I think one of the things that excites me most is that even when the conference ends on Friday, our work continues.
Now, of course, you also are putting a focus on women, being International Women's Day. Would you like to tell us a bit more about that?
For International Women's Day, we're having an all-women plenary, which I will be chairing, and the theme for that is women, development and tobacco control. It is so important to put the focus on women, because as you know, women are the caregivers at home, and so we are very excited to have this all-women plenary. We will have the WHO Regional Director for Africa, Dr Matsidi Somweti, will have one of the top scientists and advocates and gurus globally, Judith Mackay, coming in, and we'll have Lauren Greaves as well, who is a gender activist, and we will then have our own DG, Ms. Matsoso, being part of that panel. So it's a fantastic group of women. And
that aside, final question, what else can attendees really look forward to this week?
This week is chock-a-block, and one of the things about the WCTOH is that it is the premier policy conference globally, and it is the one place, as I was saying, where you meet advocate, young person, political principle in one table. During the next few days, you can look forward to cutting-edge workshops with the top scientists globally, bringing up the best science that there is. And so for the politician, you will be able to get new evidence for your policies. For the advocate, you'll be able to get new taglines and new ways of making sure that your message is actually evidence and evidence grown. We're also going to be debating around issues of taxation and what countries should be doing. And I think finally we'll be talking about issues around harm reduction.
Okay, sounds great. Thank you very much for highlighting that for us, and thank you for your time.
Thank you so much.